warm welcome to everyone on the behalf of the Prevention Collaborative and our colleagues from Promundo and UNICEF. I wanted to welcome all of you to our webinar today. We'll be talking about the landscaping of gender transformative parenting programs. So thank you for joining us. And I just wanted to walk us through the meeting etiquettes before we start our webinar. Great. So please enter your questions to the panelists using the question and answer box. You can see it at the bottom of your screen. And we welcome to use the chat if you want to make a comment. So make sure if you're making a comment, you click to all attendees so colleagues can see, not just to panelists. We also want to let you know that the meeting will be recorded for the sake of those who couldn't make it and future reference. So if by any chance you don't want your voice to be heard, please let us know and the technical team will make sure the part is omitted. Before we start, we would like you to introduce yourself and keep introducing as we go, as you join. Yeah, just put in the chat box your name, the country you're joining us from, the organization, or if you are just an independent person, we'd like you to put in the chat so we know who is in the room. So I hope that is clear, and I'll hand over to our colleague, Lori, who's gonna introduce the speakers and then moderate the rest of the webinar. I wish you all to enjoy the webinar. Thank you.
Great.
Over to you, Lori.
Welcome, everyone. I'm Lori Heisey, and I'm the Technical Director of the Prevention Collaborative. What we're really trying to do today is actually just share notes and do a little intelligence gathering amongst all of the groups who are really starting to do some interesting work in the space of trying to make parenting programs more gender transformative and really trying to take on board how can we strengthen the family as an entity with a gender perspective. And many of us have been involved in debates over the years about the tensions and some of the hesitancy of really trying to program to reduce both, let's say, violence against women or intimate partner violence, together with violence against children. And because all of us live in this world that is very siloed, there hasn't been until recently much work at that intersection. But a few of us came together as organizations into the beginning kernel of an affinity group to try to bring together and create a community of those folks. I call it sort of the coalition of the willing, who are trying to pull together and figure out the best way to reduce both violence against women and children and to strengthen the family and promote gender equity within the work that we're doing already, whether we come from parenting or violence against children or violence against women programming. So today, really what we're doing is we want to hear from some of the groups that have been taking the lead in this space, just to kind of get an idea of what's going on, because we were surprised when we did this exercise just amongst ourselves how much actually is going on in this space. So we thought a very important first thing to create a community is just to start to share and to get a sense of who's doing what so we could start to create some relationships. So today we're going to hear from 3 separate groups, a few extra people from UNICEF, and we're going to share, and then we're going to create an opportunity, hopefully, for you to share, because we're really at the very beginnings of trying to landscape and create this community, and we want to invite you in, and we want to know what you're doing. So today we're going to have 3 presentations. The first is going to be by Lina Digolo, who is the senior associate with us at the Prevention Collaborative, who's based in Kenya. She's going to talk about our work. Then we're going to go to UNICEF, and we have 3 colleagues from UNICEF. We have Stephen Blight, who is the Senior Advisor for Child Protection at at UNICEF headquarters. We have Alessandra Guedes, who is the Gender and Development Manager at UNICEF at their special center in, I'm always very jealous, in Florence, at the Innocenti Research Center. And then we'll also hear from Shreyasi, who's the Senior Gender Advisor at UNICEF. And after that, we'll move on to Clara Alemann, who is the Director of Programs at Promundo in the US. So without further ado, let me invite our first speaker, who is Lina Digolo.
Thanks everyone for joining the webinar today. I'm looking forward to hearing everyone's experience around working in this space. So I'll just take a few minutes to update you or to let you know what we're doing at the collaborative, and particularly zooming into our work around the boyhood intersection and parenting programming. So just as for those who've not heard about us or those who this is your first time to join us, the collaborative is a group of it's a global network of practitioners, activists, and researchers who came together to really work better to equip ourselves and others with the skills necessary to end violence against women and violence against children. We work to strengthen the capacity of actors to deliver cutting-edge prevention programs that are really informed by research-based evidence, but also practice-based knowledge, and follow feminist principles. So just zooming into our work around the boyhood intersection, this was based on the literature and the evidence that's coming out around the evidence that really informs why we should work at the intersection. And you'll be hearing more of this from our colleagues at UNICEF, so I won't spend too much around this, but we now know that there are many areas where these two programs intersect. So they have shared risk factors, common social norms, common and compounding consequences. They overlap in certain stages of life, e.g. adolescence, and both have intergenerational effects. So we'll be hearing more about this, but these are some of the background in which we really decided to focus around this work, and we are working with different partners to really strengthen their areas in this work. When we made this decision to work at the intersection, based on the literature, we found that the parenting program is actually the one that has a lot of work around this, especially the research that shows that it's possible to work here and actually get positive effects in terms of reduction of both bow and back. And so this is the area we opted to prioritize because, again, this is a new space. And at the beginning, we needed to understand, more around the parenting program, who's working here, who's really already working at the intersection within this parenting program. And for us to get that information, we undertook a couple of exercises, one being conducting an evidence review to understand what programs are out there in regard to those that have been effective in reducing both bow and back. But we also did a stakeholder mapping exercise where we wanted to get to know who our target audience are, what are they doing, where are they in terms of the knowledge around violence, and particularly working at the intersection. So one other thing that we did, and you'll hear more about this, is really starting to put together, as Laurie mentioned, there's work going on around this space, but we are all doing our work probably and not talking to each other much. So we know that there's many people, many initiatives around this space, but there's nowhere where they are brought together. So we made we did a first effort of starting to develop an inventory, and we'll be sharing a link with you later so that you can see what we put together, but also to encourage you and invite you to populate your work around there. So this is going to be open and available to everyone. So these were just efforts for us to be able to understand this space better. Our work, again, is focused in certain areas, just as because this is our geographical focus as an organization, and currently we're working in the Pacific, Asia, and in Africa. So how we do our work is through a number of ways. One, through curation of both research evidence and practice-based knowledge. And here, what we do, we have a knowledge hub in our website where we really synthesize and, synthesize and share with you high quality resources and really focusing on the practitioners, our target audience, but of course open to everyone else that are really focused on prevention of VAW and VAC. And in this space, you'll find that we also have material around parenting and gender transformative parenting programs. We also do this through capacity strengthening, where we work with various stakeholders, mainly practitioners within the countries, to help them first understand violence prevention, the essentials around this, but also to start understanding what are those elements within their programs that, if they put added within their programs, would strengthen the quality of their prevention programs. And we do this with various partners in the 2 regions I mentioned, and again, with the focus currently being on parenting partners and helping them to do gender transformative programming. I'll just give a few examples shortly. Then the third way we work is really what we call investing wisely, and here is where we are advocating with donors to first for realistic timelines for programming. As we know, prevention programming is one of those that you can't fund for 6 months. You need adequate time. We know that there's evidence that, you can have reductions of both VAW and VAC within programmatic times that allow around 2 to 3 years. So starting to advocate for that adequate time to be given, but also to help them understand what effective prevention programming is and help them to start funding this appropriately and adequately. So just zooming into our VAW-VAC work, and particularly the parenting part, I'll just give you examples of some of the work that we've done to date. So the first thing is that we did a position paper, and you can access all this through the links. We'll share this presentation with you. And this was just to make to give a rationale for why we've decided to really work at the intersection, particularly through trying to prevent violence within the family. And then we did an evidence review. We have both a long version and a brief version of this that was updated in 2022. So again, these 2 are available online. These were just, as I mentioned before, to help us understand the parenting programs that have effectively worked at the intersection. Our focus with this evidence review was really in the global south, but it gave us an idea of what exists out there. Then we've done some program briefs, and you can see the 2 examples I've given there, Real Fathers and Badebehero. There's, I think, 2 more online, but that's just to give you an example of some of the products that we've developed. We have program guides online, and you'll find some like webinars that we've done and other multimedia products that we've developed. One example that I've given there for the multimedia product is a short video that we developed. After starting to talk with the different partners, particularly practitioners, we discovered that there were some concepts that were a bit difficult for them to understand. So starting to think about how else can we package this messaging so that we make some concepts that might be difficult easier to digest for the practitioners. So you'll find one there that was very focused on the VAW-VAC intersection. So that's an example of what we have, the different products that we have in our knowledge hub. Around capacity strengthening, we've also done a number of things. We have a learning lab online in our website, and this learning lab is really focused on. It has various courses. We've just newly unleashed our VAW-VAC intersection course. It's fresh off the press. We invite you to go in and join. Just launched, I think, 2 weeks ago. And we have also other courses that are important, even as you're thinking about working at this within this space, the prevention essentials, and how, VAW-VAC and elements, what we call how to succeed. So you'll find different courses in our learning lab, and these are really focused on helping individuals who are interested in strengthening different components of their work. And you have self-paced courses, 2 to 3 hours, and we also have facilitated courses which you can join. So that's our learning lab. And the other product we have in terms of capacity strengthening is the accompaniment program. This is a more long-term sort of mentorship program that we have, working with different partners for a period of 18 to 24 months. And the partners are attached to a prevention mentor who works with them with focus on objectives that the two organizations agree on, and they work together for that period to achieve those objectives. The most recent learning partnership that we just completed in regard to supporting the organization to strengthen their gender transformative parenting program was with an organization in Kenya called ICSSP, and they now do have a gender transformative program that's been currently adapted for national level by the Kenyan government. So that was quite a successful accompaniment program that ended just early last year. Then we are now introducing a new product called the cluster program. And here we hope to bring together 6 organizations to learn together for a shorter period, about 6 months. And this is really aimed at helping organizations, network, but also recognizing that within an organization, we need critical mass for people to be able to bring change at organization level. So the Learning Lab, we've had individuals coming, but recognize that when they go back, then sometimes it's hard to be able to implement the learnings. So here we hope that by having 4 to 6 people from an organization joining and learning the key principles of prevention programming and staying with us for about 6 months, we'll have that critical mass within the organizations, but also bringing more organizations on board within that period. Then we hope with time we'll have within the countries and a larger number of organizations that have benefited from this program. So that's also a new product that we're just starting the first cluster this July in East Africa, and we hope to continue with that. Then we have other offerings like strategic advisory services, and this is where we work. We are contracted to work short-term or long-term by different partners, and the 2 that we've done that are very relevant to the parenting space is the work that we are doing currently in Kenya, helping the Kenyan government develop a parenting program that's gender transformative. This is really informed from the work that we did with ICS, so learning more about the context, but also bringing the research from the global level and the practice that we worked together with ICS and starting to help, we strengthen some of these national policies. And we are doing similar work in Timor-Leste to supporting, to strengthen the UNICEF parenting manual to also be gender transformative. Then we've also spent a lot of time internally building our own capacity through learning circles. Some of these are internal, but we also have sessions where we invite other people interested in the same work from externally. And we also have virtual coffees, which are mainly aimed at allowing our mentors and learning partners to come and share their learnings. Finally, I would like to mention our advocacy and influencing work. And this is where we, as Laurie had started talking about the community of practice that we are hoping to really expand with like-minded partners who are interested in this work around gender transformative parenting to come together and share their learnings. We already have a small team that has been continuously missing this, and we've been a convener for this work. And then we are also participating in various advisory groups that are looking towards strengthening this the work of this space. And also the working with various donors and funders and governments to help them think through about how to strengthen their parenting programs to work at the vulva intersection. I already gave examples in this. So in a nutshell, that's what we are doing at the collaborative. And you can find all our resources in our website, the resources that we've developed and some of the work that we've done in more details. We invite you to that. We'll also share the link to the parentive, the matrix that we developed, where we put up some of the initiatives that we already know about, that we are participating in, and encourage you to sign up or start populating it, or just use it to learn what others are doing in that. Thank you.
Just so that we can get all of the exciting work on the table, I am going to pass it over to my colleagues at UNICEF. And they're going to take us through some of they're doing quite a bit of work in a lot of different areas. So there's 3 of our colleagues who are going to be sharing, and I will pass it over to you.
Hello, everyone, from all of us at UNICEF. So as Lori just mentioned, we're doing quite a bit of work around gender transformative parenting at UNICEF. If I could get the next slide on. Our vision, we've been working with parents for a very long time, and last year we sort of got it all together, and we came up with our strategy that put together UNICEF's vision for elevating parenting through all of our work. Given UNICEF's comparative advantage and the needs of parents and children, we focused on 5 key approaches. These approaches are meant to be complementary, so they're not meant to be necessarily seen as a package, but they've seen us as complementary, and more than one approach may be needed to be adopted simultaneously. The first pillar of this approach is, of course, promoting positive gender norms and socialization, which essentially, where we support parents and caregivers, and through frontline workers, to make sure that throughout the life course, we are promoting non-discriminatory gender norms. So we try to get to the heart of the process through which gender norms are actually transferred, through early childhood to middle childhood to adolescence, through parents and caregivers, and what are the main entry points to actually try to start shifting some of these norms. The second pillar was strengthening enabling environment, where we look at the kind of support that parents need, whether it is the kind of political, budgetary, institutional support that parents need in order to continue to support take care of the children. The third pillar was strengthening the workforce capacities. And here we really focused on looking at the frontline workers, whether they are employed in the childcare sector or the social service workforce, and looking at the role that they play in transferring some of these norms and supporting, and what kind of support do they need in order to be able to work with parents. And throughout all of this, we have the underlying theme of promoting positive parenting and gender norms through all of these areas of work. The fifth pillar is, of course, directly empowering parents and communities so that they themselves are engaging in these parenting programs that we're designing. And finally is raising the awareness levels. This can be done through innovative engagement that we do, digital campaigns, platforms. We have a number of apps that UNICEF has developed that provides information to parents across a whole range of issues and topics. So these are the 5 sort of key strategies that we're using, for our parenting programs. So moving on to the next slide. This year also marks that UNICEF's new strategic plan. We are just embarking on a strategic plan that will cover the time frame from 2022 to 2025. And building off of the parenting strategy that was developed last year, we have identified very clear results within our strategic plan, which has a focus on gender transformative parenting and the linkage that it has to violence within families. So we have 5 goal areas that UNICEF has identified in the strategic plan. And under goal area 3, we have a very clear result of working with parents and a number of indicators that will allow us to track our results in this area. The strategic plan also builds on the child protection strategy that was finalized last year, that also covers the next decade, is 2021 to 2030, where again there is a very strong emphasis on positive parenting and caregiving and preventing and using gender transformative strategies that will empower parents to adopt positive parenting approaches. In the next slide, we see that the strategic plan that UNICEF has also aligns with our gender action plan, again, where the emphasis is very heavily on looking at the role that parents play in promoting positive norms, positive gender norms within families, and how can we influence that, recognizing, of course, that parents are one of the critical determinants, or one of the main sources to which children actually learn about gender norms early on in their lives. So we, within the gender action plan, again, we have identified a very clear area of work on this particular issue. We also are working with parents under our nutrition work, because again, looking at how, what kind of supporting environment do parents need in order to continue to take care of the children in early childhood, and how does that actually link to the gender equitable distribution of household decision making, including the decisions around the kind of the nutrition that is available to boys, girls, but also to the adults within the families. So what exactly is gender transformative parenting, and how is UNICEF defining it? So in the next slide, we talk about what is it that we mean when we say gender transformative parenting. So for us, when we look at gender transformative parenting, it's really parenting where we are infused, that is builds on key normative principles and such as gender equality and inclusion, and it promotes positive gender norms and socialization with the objective to transform the underlying power structures and the continuation of these power structures into future generations. So we are, in a nutshell, really trying to change how gender plays out within families and within those caregiving roles, and what is it that we can do to actually shift those underlying power structures that determines the decision making within households, who's taking care of the children, who is involved in the caregiving, and how do we actually go about bringing this change. So that's how we're defining gender transformative parenting, that looks at transforming these underlying gender norms. In the next slide, we will look at what are some of the key strategies that we that are involved in our gender transformative parenting approaches. So the number one, and this aligns very well with our UNICEF's parenting strategy that I just talked about. The 5 pillars of the UNICEF parenting strategy. So number one, we work on direct with parents. So we have programs, that my colleague is going to be talking about with some examples of these, where we are working directly with parents in terms of shifting gender norms, but also with frontline workers who have the most direct interaction with parents. One of the second most important strategy that we apply is to encourage male engagement. So looking at caregiving not just as a female responsibility, but also engaging men in caregiving within families and communities. We also look at the equitable distribution of resources. So this goes to the result that I talked about around nutrition. So when we're looking at resources, whether we think of that as nutrition within families or income within families, how are these resources being distributed, and how do we actually make sure that the resources that are available within families are equitably distributed? Looking both the role that parents play as in role modeling to children, but also making sure that there is equity within families. The fourth pillar is ending harmful practices at home, and this is where the most clear linkage to violence prevention comes in, where we directly work on trying to prevent violence within families. Again, looking at the role of parents as role models, but also making sure that we don't have those kind of practices within families. And finally, and this links to the enabling environment pillar of the UNICEF's parenting strategy, is the family-friendly policies. Is what kind of policy support, what kind of budgetary, what kind of political support do parents need in order to take care of the children? And within the family-friendly policies, umbrella, we have a number of policies like equal, parental leave, providing, cash subsidies to families, cash subsidies to mothers specifically, looking at the childcare issues. So these are the 5 sort of pillars of our gender transformative parenting approach. And I'm now going to hand over to my colleague Stephen to take us through violence prevention.
Thanks, Shreyasi. Yeah, so I'll be zeroing in on goal area 3 of our strategic plan, protection of children from all forms of abuse, neglect, violence, and harmful practices. And the issue is framed as follows. Globally, 3 out of 4 young children, that is children who are under the age of 5 years of age, experience violent discipline on a regular basis. And experience of abuse and neglect in childhood is a leading preventable cause of mental disorders, of intergenerational violence, and other poor life outcomes. Families everywhere are experiencing exceptional challenges in this time of the pandemic, with many parents with young children battling with severe stress. And the quality of parental attachment with children is the single most protective factor against abuse and neglect. Next slide, please. So there's a strong body of knowledge that's underpinned by hundreds of evaluations from all regions in the world, showing that positive parenting delivered through parenting support interventions have sustainable impacts on child well-being and development. So they show that a delivery of a core content of quality parenting support can strengthen positive parent-child interactions, reduce harsh or dysfunctional parenting practices, and improve caregiver mental health, all factors that reduce violence against children, but also contribute to a variety of other positive outcomes for child development and well-being. And we know already what makes an effective parenting program. We know that they include a core content that's readily adaptable across many contexts at varying degrees of intensity and for different age groups. And this core content is grounded in social learning and attachment principles and focuses on providing parents with practical instruction on child development, on positive parent-child interaction, socio-emotional learning, and parents' own communication, self-regulation, and anger management skills. And this core content, this same core content, is relatively consistent across evidence-based parenting programs. Next slide, please. So last year, UNICEF supported parenting programs reached over 3 million mothers, fathers, and caregivers across 94 countries. And these programs all addressed some components that addressed risk factors associated with violence against children, and all provided interactive curriculum or face-to-face support for parents. And where we were able to get disaggregated data, it shows that 30% of program participants were fathers. Next slide, please. So can parent and caregiver support at the same time reduce intimate partner violence? So from evaluations in some countries, and I'm thinking of our evaluation a couple of years ago in Philippines, for example, this very same core content of quality parenting support can have moderate effects in reducing intimate partner violence, even when the programs are not specifically designed to do so. So how does this work? We can hypothesize that the core content of these programs that include building of empathy, emotional self-regulation, communication skills are also relevant in intimate partner relationships. Now, what about more intentional impacts? We're finding that the incorporation of elements that directly address family violence can strengthen this contribution to reducing intimate partner violence amongst the program participants. And we've got a recent evaluation of the Care for Child Development program in Papua New Guinea that shows this. And while the overall focus of the program was on parenting and child development, there were some elements of the program that talked about family violence, including intimate partner violence directly. And we believe that the incorporation of some powerful messages in the curriculum impacted on reducing violence between intimate partners. And finally, by targeting the development origins of violent behavior, can effective parenting support break the intergenerational transmission of violence? Of course, we would need longitudinal studies here that do not exist as far as I know, but we know that the experience of abuse and neglect in childhood makes it more likely that the child will be a victim or perpetrator of intimate partner violence as they grow up. What are the pathways for this? Does early exposure to violence in childhood establish a behavioral script so that violence becomes established at a very young age as a normal way that humans interact with one another? Does the persistent fear and anxiety associated with violent discipline create toxic stress that permanently alters brain architecture and chemistry and undermine behavioral, social, emotional functioning as children grow into adulthood? We know that externalizing behaviors, such as aggression in young boys, is a consistent predictor of later perpetration of intimate partner violence, and that parenting programs are effective means of treating such behaviors. Next slide, please. Just rapidly, some examples of our work that show innovation and scale. We're working more on incorporating digital engagement through the use of text messages, chat-based platforms, and parental apps. We're incorporating parenting programs into social protection cash transfer schemes in such countries as Philippines and Sao Tome and Principe. We're reaching parents of adolescents through, for example, public provision of parenting support where adolescents are in conflict with the law, and Malaysia is a great example of that. We're engaging men more and more through fathers networks, for example, in Timor-Leste, in South Africa in partnership with Sankey Men's Care, and in the copper mining sector in Chile. We're reaching parents of children with disabilities, for example, through individualized online support to supplement group-based programs in such countries as North Macedonia. In 18 countries in Eastern Europe and Central Asia, we're providing parenting support through universal progressive home visiting programs and incorporating parenting programs in health service delivery in such countries as Thailand, where parenting programs for young children are incorporated with the Thailand Health Promotion Hospital System. Let me pass over to Alessandra now.
And hi, everyone. I only have 3 slides to share with you, and we're very mindful not to take over the webinar. But as you can see, UNICEF is a very large organization. You heard from Shreyasi, who sits in the gender group, Stephen sits in the child protection group, and I sit in UNICEF's Office of Research, which, as Laurie mentioned, is based in Florence, Italy. And we've been really looking in a very intentional way at the intersections between different forms of violence against children and violence against women. And the idea of our work is, of course, to support both UNICEF's own programming, but also the field more broadly. So roughly, we organize our priorities around these 3 different domains. One is producing and promoting the use of evidence on gender transformative approaches to violence prevention. And that includes both synthesizing evidence and creating new evidence. And I'll come back to that in the next slide. The second one is exploring emerging issues for UNICEF's work on violence prevention. For example, Innocenti and UNICEF more broadly have a strong program on children's digital lives that includes a focus on online forms of violence against children. But we know that online, offline is not a black and white divide, and we're doing more to look at how these forms of violence intersect and how we can use technology to both prevent and respond to violence. And third, similar to the Prevention Collaborative, we're embedded in different networks, and we use these networks to build capacity both internally at UNICEF, but also more broadly. Next slide, please. So if I focus only on the first priority, and I have to apologize because there was a mix-up in the slide, so hear my voice rather than look at the slide. But the first set of bullets actually refers to how violence against children and violence against women intersect. So we've been collaborating with a number of partners, including the London School of Hygiene and Tropical Medicine, with whom we have 2 systematic reviews going. One that should be coming out this week or next, that looks at the co-occurrence of intimate partner violence and child maltreatment, and it's a systematic review globally. We've also done some analysis of data that has come out from national surveys in Latin America, looking at the frequency of co-occurrence between violent discipline of children and intimate partner violence, as well as what factors are associated with increased risk. Then we're also looking at the implications of these intersections for policy and programming. We have another systematic review that's about to be finalized in the next couple of months, looking at the promising and effective interventions that address these forms of violence in a simultaneous way. And we worked together with our partners, the regional office in the East Asia and Pacific, as well as with UNFPA and UN Women, to do a 4-country multi-study, 4 countries study, looking at how services and programs are already trying to address these intersections on the ground. And we're continuing to build out that work. And then I wanted to call your attention to this large effort that we have going to try to identify priorities for the research on the intersections of violence against children and violence against women. And this is something that we are undertaking with the Sexual Violence Research Initiative and the WHO. And there's still room for you to become involved and rank questions that are coming up. We received over 400 research questions that we will be ranking the next few months. So if you're interested in that effort, please do seek that out, and there's a way for you to register. Next slide. We just wanted to finalize by sharing a few key resources. I'm not going to go into the details, but hopefully once you receive the slide set and you're interested, you can seek those out. So thank you so much.
So I will briefly tell us what Promundo is about, what we do for those that might not know the organization, what our approach is to gender transformative programming, and some smattering or insights, illustrations of specific gender transformative parenting programs that we are working on right now. Next, please, and next, please. So the next, please. Promundo is an international NGO that was founded 25 years ago in Brazil that engages men and boys, as Lori was saying, as citizens, fathers, employees, as well as the institutions in their lives, to practice values of respect and equality, to support women and girls' leadership, to be caring parents, and to call out discrimination and violence when they see it. We believe that the work with men and boys is not an end in itself, but rather a means to promote gender justice. And therefore, Promundo works to achieve gender equality and social justice by transforming the intergenerational patterns of violence and promoting patterns of care, empathy, and accountability among boys and men throughout their lives. We envision a world where all people work to create non-violent, caring, and gender equitable futures for themselves and for their children. And for the last decade, I would say, Promundo's focus has been on building partnerships in Latin America, Africa, Middle East, South Asia, to carry actionable research to inform the adaptation of gender transformative programs to different settings and to build also global advocacy platforms to engage men and boys as allies in advancing the 3 pillars of our strategic plan, our new strategic plan, not yet public and launched, which are care, equity, equitable gender socialization, and the prevention of violence against women and their children. We also have focused, I have to say, building partnerships and testing our work in the US and Europe to reflect the universality of harmful gender norms and structural inequalities. So very briefly, our work is clustered or organized in 3 main pillars of work. We conduct research that informs the knowledge base about what contributes to shift these restrictive gender norms that we are all talking about and trying to transform from within communities and institutions. We co-develop, adapt, test, evaluate, and explore how we are learning how to scale up gender transformative programs in partnership with local communities, civil society, and government to prevent violence in the family. We do this, but also by strengthening partners' capacity to lead in the countries they live and work, gender transformative programming, and finally leveraging the research and programming to carry out national and international advocacy that can shift these harmful gender narratives and raise awareness about the drivers of violence and how to prevent it. Next, please. So Promundo works with a gender relational approach, this meaning with women, men, and individuals of all gender identities at the different levels of the socio-ecological system, which we know that from the evidence it is what causes greatest impact. We engage with children, adolescents, parents, and communities, while also seeking to influence the institutions and power structures that shape and maintain these gender norms, such as schools, health services, workplaces, through the research and programming that I mentioned. And as examples in our current strategic plan, some of the ways in which we are doing this, and I was seeing alignment with UNICEF, we work also to strengthen systems, capacity, and skills of frontline providers in the health, education, social protection, and childcare sectors to support parents to practice caring, nonviolent communication, and discipline in the family. And also we are creating methodologies, resources, and scalable parent engagement approaches to raise children free of restrictive gender norms. And this is not only in the early years, 0 to 3, but from 3 to 13. Next, please. I wanted to just talk a minute about why engaging fathers is important in parenting and the prevention of family violence. I think evidence was alluded in the previous presentations, but likewise, a growing body of evidence has improved our understanding of the ways fathers can positively impact the health and well-being of their children, as well as their female partners. It has become very clear that fathers can and do distinctly contribute to foundational components for children's growth and development, including early learning, nurturing care, and the protection from violence in the home while growing up. And while evidence demonstrates the impact of fathers on children's early development, we know that most parenting programs primarily focus on mothers and female caregivers. Stephen mentioned 30%, that's progress. Sometimes it's even less, 30% of male participation in parenting programs. Often that it's even less. And we also wanted to say that when we talk about men's positive engagement as fathers, we understand this as going well beyond them stepping in to perform childcare and domestic work. We understand the concept of male engagement as fathers to encompass their active participation in protecting and promoting the health, well-being, and development of their partners and their children. It involves them fostering a respectful and caring co-parent or couple relationships if they are living together. It also involves making decisions with their partners and supporting their partners' autonomous decision-making, and being emotionally connected with their children and partners, even when they may not live together. This includes not only providing financial support, but also emotional and physical support. And finally, it means taking joint responsibility with partners for the workload, caregiving and domestic work, and resolving conflicts in a constructive way. And this, of course, is at the basis of preventing violence in the family. Next, please. So now, what is it exactly we do to engage men as fathers and their female partners? One of our longest intervention is called Program P. We know that fatherhood can be a very transformative moment for men as they reassess their identities, relationships, and futures, and engaging them, especially around the first birth or the early years of their children, in critical reflections about gender equity can have multiplicative impacts on the child, partners, and fathers themselves. So Program P is a group education, multi-week curriculum created by Promundo, originally in Latin America in partnership with Cultura Salud in Chile, Red Mas in Nicaragua, grounded in a feminist framework and meant to be adapted to gender dynamics and parenting practices in varying contexts. The original manual includes 3 components that are meant to be implemented jointly to reinforce its impact, although often the group education is the most known. So the first one is a guide to work with health professionals on how to engage men in the prenatal, maternal, and child consultation space as a key entry point. The second then is the group education sessions, 10 to 15, depending the country, engaging men and their female partners through a structured curriculum that provides reflective space for intimate partners to challenge and critically reflect on restrictive gender norms and how these shape their lives and their family relationships. Second, to rehearse equitable and non-violent attitudes and behaviors in safe spaces with peers. And third, to internalize positive social behaviors related to men's caregiving and the involvement in their children's lives, as well as supporting their female partners' decision-making, and to apply it through very concrete invitations and exercises throughout a period of 4 or 5 months. Finally, there's a step-by-step guide for them to create and launch community campaigns to support social mobilization strategies, engage with peer groups, institutions, services, and policies that will help sustain these changes beyond the implementation of the program. We know that individuals alone will have more difficulty in sustaining these changes. This program has been adapted now in over 20 countries, including in Rwanda, where a rigorous evaluation showed that after 2 years of the intervention, men were nearly half as likely to use violence against their female partners and less likely, like 15%, to use physical discipline against their children. Next, please. So talking about the methodology, just a snapshot to illustrate how parents share experiences in peer groups. This is Bolivia, where fathers and mothers had preferred to meet separately at the beginning, where they felt safer. These groups are facilitated by trained facilitators, men and women facilitators. Next, please. This is also in Bolivia and in Guatemala, where just an example of how participatory examples with fathers, mothers, and couples allow them to really become aware of the inequalities in their lives, driven by harmful norms, and practice new skills around couple and parenting, child communication, many that Stephen mentioned, discipline, positive discipline methods, joint decision-making, and sharing of caregiving and domestic work in non-judgmental peer environments. And we've seen how this process can lead to changes across a range of health and behavior outcomes, key to building caring parenting relationships. Next, please. So these are some of the examples of that are in our current portfolio. First, I wanted to say all of these programs are co-developed with partners in the countries listed in this snapshot. In Colombia, we've worked for the past years with our partners CINDE, who are specialized in early childhood development, adapting and piloting in Bogota, Program P, with couples of Venezuelan migrant and Colombian internally displaced families. It includes sessions with activities specifically dedicated to stimulate children's development, and the rest with couples, where parents can, including some where parents can play with kids to develop empathy and foster connection. In the current phase we are now starting, we include plans to explore hybrid and digital modalities to enhance father engagement and a more robust evaluation, including observational measures of co-parenting, gender dynamics, and also we'll be exploring the feasibility of this model for scale up with the Child Protection Public Institution in Colombia. In Palestine, we've worked with our partners, the Palestinian Counseling Center and Aisha, both specialized in GBV prevention, mental health one, and in GBV response the other, to adapt and pilot Program P that has been implemented in Ramallah and Gaza, including a trauma lens to address the needs of conflict-affected families living under Israeli occupation. In Morocco, a pilot is underway with our partners Quartier du Monde. Sorry, I'm rushing. I can give you all of the details for all of those interested after the presentation or via email. The third set of programs I wanted to share is a new approach in Jordan and Kurdistan, where we are developing for the first time intergenerational approach. This means developing an integrated curriculum to work with adolescent children, age 12 to 14 in Jordan, 15 to 19 in Kurdistan, and their primary caregivers to promote gender equitable relationships and prevent violence in Jordan, with a focus in preventing harsh discipline and child marriage. And this also includes a community mobilization components. And in Kurdistan, this also includes working with boys and men who have experienced trauma in a trauma-informed group education curriculum with our partners Living Peace and SEED. Finally, a multi-component program that is just starting with our partners FOS Feminista in Latin America, where we'll be adapting Program P in Mexico, Ecuador, and Paraguay with our member associations CEPAM Guayaquil, MEXFAM, and CEPEP in Paraguay. And so Program P will be delivered through their community health centers. And we are strengthening the capacity of civil society organizations and health providers to then effectively engage men and boys in parenting and GBV prevention in these countries. Next, please. One of the last examples is Bandeberejo, who some of you might have heard about, is a couples-based parenting program with the longest footprint that has evolved through a very strong partnership between Promundo, RWAMREC, and the Ministry of Health in Rwanda. After 8 years of testing, evaluation, revisions to its current curriculum that has been now validated and adopted by the Ministry of Health, the program is being now integrated into the health service in one district via the decentralized health system using community health workers since 2019. More than 30 district health authorities have been trained to oversee the implementation. More than 400 community health workers have been trained and are implementing group sessions. And more than 10,000 parents were reached until last year. In this current phase, we are hoping to focus on learning on the feasibility, quality, fidelity, and costs from this phase of scale up to inform the national scaling up strategy. As you see, scale up takes a very long process, as Lina was talking at the beginning. Innovations to the program include using remote and digital modalities to support the community health workers in real time, and also a mobile app for them to access support for session implementation and refresher training while they are spread in places where they might not convene in person in a timely manner. So I think my time is up, Lori, or I can share the work on early childhood.
I think you can go ahead and do that.
Okay, just very briefly, because this is Promundo's most recent intervention. It's called the Global Boyhood Initiative. And it emerged given the growing global awareness of the need to start very early in engaging boys in healthy masculinity and the prevention of violence. And to address some of these messages that boys receive while growing up that encourage them to close themselves off emotionally and reinforce sexist attitudes and behaviors that can encourage the use of violence. So the Global Boyhood Initiative is designed to break this pattern by supporting boys and adults in their lives, like teachers, parents, coaches, with the resources they need to raise, teach, coach, and set an example for boys to become men that are caring, capable of developing close emotional connection, which is what starts to break this empathy that we were talking at the beginning with others in their lives, and challenging the belief that for boys and men, violence is the normal way to resolve conflicts. We started with Partners Plan and Caring Foundation working in the UK, currently France and Italy, with the school system, so developing curriculums and trainings for school systems and teachers in these countries, and are currently starting similar work, first with research in Mexico, and I forgot to mention the USA, where curriculum for children aged 4 to 13 is being delivered by the Boys and Girls Clubs of America, that some of you might know reaches all corners of the country. So we are very excited about this new intervention that sits between like early childhood development and adolescence, and we think really will help build environments where, again, boys and girls, this is for children, can grow up like free of gender stereotypes. So thank you very much for those extra minutes, Lori, and looking forward to the conversation.
Let me go back to some of these answered questions and allow the speakers to elaborate them on them a bit. So one of them I thought was a very interesting thing is that Fidelis Mutoni had asked about difference in outcomes when programming is offered individually versus in group sessions, which I think is a very interesting and important question for us as a field to think about. And I know we had two answers here from Clara and Stephen, but would you like to take a moment and just elaborate a little bit on that? Because I do think there's more individual home visiting in the child space than in the violence against women space. And there may be some other observations that anyone could offer. So I'll first turn over the floor to either Clara or Stephen if you want to elaborate, and then I'll go to Lina, who has her hand up.
So Lori, happy to just talk based on what we know. We seem to find that a lot of what has to do with socially shared ideas around gender roles and what is expected from being a man or a woman and how that affects parenting is socially constructed. So the work of critically reflecting and exchanging concerns and ideas and practicing new norms and behaviors and coming up with new solutions, let's say, to what was before done through harmful ways or restrictive ideas, comes from a group that gradually builds trust and is not taught, right? It's not many home visiting programs, parenting programs. Usually it's either a health promotion worker or an education specialist that visits the mom and somehow models certain behaviors like praise or other types of parenting skills that are probably very good for, let's say, child stimulation, but not necessarily engages mothers, fathers, couples in long-term processes of reflection and practice. So this learning, the social learning from peers, from the group, we find, and the evidence seems to indicate that is one of the core components of gender transformative parenting programs. Some effective programs do complement this with home visiting, so that's also a very good strategy to strengthen and to enable spaces of maybe more intimate discussion with couples or with men alone or with women alone if this were relevant. But this is what I can elaborate for now. Hopefully that helps.
Great. Stephen, do you have anything you want to add, or?
No, I just, I mean, most of the kinds of programs that UNICEF supports are group-based. And I think in low and middle income countries, the group-based programs are more affordable than home visiting. But the evidence shows that either home visits or group programming, group programs, they're both effective. I don't know if there's been a comparative analysis, but as was just pointed out, the group-based programs have certain advantages, and that you know, parents share problems and solutions with other parents. So there's that that social aspect. Whereas the home visits, it provides a chance for you know, more tailored help and a closer relationship with the social service worker. So both have their areas of strength, and both are recommended.
Great. Lina, did you have something you wanted to address with this, or do you have another point you'd like to make?
Yeah, thanks, Laurie. I think I agree with the two speakers. Based on our evidence review, where we looked at the different parenting programs that had effectively reduced both VOW and VAC, we found that there was value in considering combining both the group format and the individual sessions. Of course, the group format seemed to have favored the critical reflections that Clara was talking about, the sharing in groups, but there was also value in the individualized sessions that allowed for the facilitators to have that personalized contacts with family members and help them share more intimate concerns. So programs like the Real Fathers, Safe at Home, and a number of other programs seemed to have had that combination of the two approaches as part of their component.
And one thing I would add is just, I mean, we have an interesting question here from Bernadette Crawford, who says, you know, is it possible to engage in the affinity group as a INGO working on GBV prevention? And one thing that I think has come out very strongly from the evaluation of group-based interventions working specifically with the intent to improve relationships and reduce violence amongst adults in the family is that they've had the unintended, or not unintended, but they have had positive impacts on parent-child relationships and on reductions of violence against children, without that necessarily being an explicit part of the design. And I think that's quite promising in the sense that we're able to now build on that. And how do we actually more explicitly, whether we're coming at the issue primarily from our experience in violence against women programming, or primarily from our experience in violence against children, or just parenting in general, how do we consciously build on this relationship and the possibility? So I think that's a really thing. And so my simple answer to you, Bernadette, is yes, I think you can. And it's very important for groups working on violence against women and intimate partner violence and things to be part of the conversation, partly because I think we bring more background in some of the gender related work, and that's an important component. So anyway, I will, let's see, do we have, I'm gonna invite once again, if anyone wants to ask a specific question in verbally to raise their hand. But one thing that I noticed here that didn't get fully explored is that our colleague Osvaldo Montoya, he asked about whether there were resources, tips, or design experience about train-the-trainer models for gender and child rights-based parenting programs to address this. And Osvaldo, I don't know if you want to elaborate, because it wasn't clear to me if you're asking about specifically the use of train-the-trainer as a strategy, so sort of the idea of cascade training, or whether you were specifically asking about the content. If you are still online, do you want to elaborate a little bit on your question? You'll have to unmute yourself. Okay, so that might not be possible. So does anyone, I mean, I think both of them are important questions, is this idea of how effective is it in people's experience when you start to train one set of people to train another set of people to train another set of people. And I think we have quite a bit of evidence to suggest that those kinds of cascades, it's almost like a game of, we have a game, childhood game in North America called telephone, where you whisper in each person's ear, and by the end it's like nothing like what started. And I'm afraid that frequently that's what you end up with these kinds of programs when you go more than, let's say, one level of trainers. But I would be really interested in what anybody else on the call's experience with this is, because as we're being pushed to scale and try to reach more people, this is an enticing mechanism. But I'd be interested in whether anyone has any further thoughts or research about, or practice-based knowledge for that matter, about the effectiveness of this. Anyone? Okay. So I think what I'll do is, one of the things I want to draw people's attention to is under the Q&A, there was, our colleagues very helpfully linked a lot of the UNICEF references. So you might want to go there. And again, we will make those available. I see Alessandra has her hand up. Let me pass the baton to you.
Thanks, Laurie. I think I'm unmuted. No, I was just reacting to a comment or question from Joshua in the Q&A, where he's asking about sort of what is the minimum program content that is needed to explicitly address gender and the intersections of violence against children, or both violence against children and violence against women. And I think, I would love to hear from other colleagues too, but I think that we are trying to figure that out. I think oftentimes what happens is that parenting programs tend to be, the ones that are evaluated tend to be on a smaller scale, and it's not 100% sure whether this set of content is going to have the same effect across settings. And one of the things that we were talking amongst UNICEF is that Stephen shared the data about, I think it was, correct me Stephen, but a lot of parents who were reached via the programs, including a significant proportion of fathers. And I think one of the things that we struggle to figure out is what happens when you take things to scale. And are you able to maintain the same level of effectiveness of the programs? So I know that there are different colleagues that have looked at the content that could be recommended, but I'm not sure that we have a definitive answer to your question as to what content that would apply, across various settings.
Great. I think we have time for just one final question, and I'm intrigued by the question that our colleague from Kenya brought up about the politics of making change in this area, and how he notes that, or it could be she, I'm sorry if I'm misgendering you. They note that there is an effort in Kenya, or at least some discussion about bringing back caning in schools, and so, you know, obviously these issues of having pushback against efforts to be more progressive in some of these spaces. And I just wondered, Lina, if, given that you've also been working in this space, sort of how, you know, how politics can affect some of this and some of the work that needs to be done in order to actually start conversations around conflicting issues, as well as keep them moving forward in the face of some backlash. I don't know what's happening with the caning in Kenya. It would be really interesting just to get a word on that.
Yeah, Laurie, I could talk about that the whole day, but in a nutshell, I think one thing we need to remember, I think this is true for both the policymakers, but also practitioners, particularly those in the VAC space and even the parenting space, that some of the concepts that we're bringing in around gender transformative programs, power relations, these are almost new concepts to them. And so just remembering that we need to take baby steps and starting from just, you know, being able to give them the information, the evidence, just the basic essential information before you can get to a conversation where we are starting to talk about, so how do we design the program? How do we bring this to scale? Those first steps are very critical, and that's what we're experiencing in Kenya. I've seen some of the team members that I'm within the technical advisory group, whereby we are in the middle of developing quite a huge program, but having a bit of pushback here and there, mainly because we are in different spaces in terms of what the evidence is and what it even means, some of this terminology means. The biggest lesson for me is within for the VAC space, a huge one of the biggest things we have to consider is the languaging. How do we package some of these concepts in a way so we are not diluting, but making sure that we are packaging in a way that it's not threatening or it's acceptable across the two fields. So that's something that I keep thinking about, what we can do, and I've seen Fidelis and other people here. It has been our biggest struggle in the Kenya policy table.
Well, I think that's probably a really good conversation for us to convene at a later date, is sort of how do we manage these tensions without so watering things down that we lose the content, but that we actually are able to start the conversation and maintain it through a social change process. So I see that we're at time, and I really want to thank our speakers for putting together this 30,000-foot view of all the activities. And I want to encourage folks to reach out to us with new work, and we will be sending, as I said, a follow-up so that we can capture that work, and also we can get some sense of the priority of the group, of how we can extend this community of practice or affinity group to be as useful as possible to those working in the space. So we will look forward to seeing you all in the future, and please look out for the email from us that has the little survey, as well as the slides and everything in the resources. So thank you, and we'll see you next time.